Rahul and Priya run a small grocery store. After overcoming big difficulties, their business allows them to live with dignity as active members of society. Honama is a 12-year-old girl. Her mother, who suffers from HIV/AIDS, is single and begs for a living in a temple. One day, one of the Franciscan sisters saw Honama on the street and found a white spot on her face. After a few months of treatment against leprosy, she began to study. She aims to be a nurse or a social worker to help people like her mother. Jayashri is 8 years old. Her father suffers from leprosy. When her mother found out about her husband's disease, she set herself on fire in front of their children. This affected Jayashri greatly, but with time she's managed to overcome it. The project provides her with psychological help and is covering the costs of her studies. According to the World Health Organization, India is the country which registers the most number of leprosy cases each year. During 2010, nearly 127,000 new patients were detected, and they're not the only ones. There are many more cases hidden for a number of reasons. For example, many tribal communities only accept natural medicine. There are also wide areas of difficult access in mountains and forests, and many other people try to hide their illness because they fear social rejection. In 1983, the Franciscan Sisters of the Immaculate Conception asked for help from Fontilles, a Spanish NGO, in order to build a small clinic for patients affected by leprosy in the district of Harapanahalli in Karnataka state. This was the beginning of what we know today as the Arogya Matha Health Centre.
It was a proposal brought to Franciscans because we have experience working in Fontilles, and we have studied the project 1990 and 91 we have sent proposal to Fontilles here in Spain, and they have agreed to collaborate with us. And it was their first international project also. 92-93 Fontilles has built a dispensary for the dressings and all. Ever since we are working in the curing the ulcers of the patients, admitting them, health education part of it, and socio-economical rehabilitation.
From 2009, with help from Fundación Mainel, and in 2011 together with Arcelor Mittal, the work has been extended to attend to other health needs in the region, always paying particular attention to leprosy. The centre focuses on education, prevention and rehabilitation, bearing in mind that it's impossible to eradicate the disease unless due attention is paid to the causes that generate it.
There is a very good treatment now, MDT and all the things, and very fast it can be cured. But it is also, our people where we are localized are very, very simple people and very, very backward mentality. They don't care when they get fever, unless and until it is very serious. For minor illness, they don't care because they are, okay, they treat with home things and all. Since leprosy is not a painful disease, they do ignore. And also in that area, there is a lot of dermatology problems. And they think it is one among that dermatology problem. They don't seek leprosy separate, they don't see. There are so many few people, they come volunteer telling that what is this patch, is it, because we do conduct health camps, and that time they come. And of course with the deformity and all, it is already too late.
It is impossible to ignore the strong social rejection against patients. This is the reason why the project is carried out under community-based rehabilitation. This strategy aims to improve living standards for people with disabilities through community and educational initiatives. This means that local resources are used to support the rehabilitation of the disabled individuals in their own environment. Relatives are being taken care of too, especially the children who receive support for their education. The AHC provides all rehabilitation and education services usually needed by patients of leprosy. These services include physical therapy, orthopedics, occupational therapy and reconstructive surgery. This way their daily life becomes less affected by their disabilities.
Before there was a lot of stigma, they used to put these people out from their houses and all. But whereas now They don't, when we detect a case, our first priority, before giving the treatment for these people, our first priority is to educate the family. So we make awareness in that family and we study the situation of the family. So simultaneously, we also help with the social rehabilitation.
Permanent disabilities push victims into unemployment as well as economic and physical dependence. Furthermore, in most cases, this leads to a process of social exclusion and poverty. A healed individual is assisted to return to his or her position in the family and in the community by means of education and socio-economic rehabilitation. Opportunities are created to help people to find employment, to contribute to family income, and to live with dignity as useful and self-sufficient members of the community.
Job is a question mark because basically they are not educated. Education is very low and they are not competent people technically. Socio-economically, so we have to help them in their own financial situation. So we do concentrate, if they are children, we do concentrate on their education program and we follow up their education program. And we support them giving the books, giving the uniforms and all those things. And we see to it they continue the education.
Besides supporting the education of the patient's children, the sisters also own a residence for sick girls and boys who receive treatment. For these children, the sisters act as legal tutors. Nowadays, the residence provides lodging for 25 children from very low-income families.
25 children are being supported, everything, food, education and everything. So 25 girls, and preferably we are selecting the girls because the lifestyle of India, girl is always looked second, first always boys. Therefore, we gave more preference for these girls. Girls should come out.
Through awareness raising and education, it's possible to change the perception of leprosy. It is necessary to create a new environment where patients are not afraid to ask for diagnosis and treatment. It is also essential to train specialized staff, health workers and volunteers of the community who will help to detect and rehabilitate the patients. To accomplish these challenges, personnel and funds are needed, resources which the most affected countries lack. This is why the collaboration of international organizations is so necessary, as is the commitment of everyone in order to achieve leprosy eradication.
I think my people would say, because I have been there for so many years working in these people, my people only have a smile and say thank you. There because they need some support. It is socially they are very much deprived of the people and they need some accompaniment. All these people they know that when they come to Harapanahalli institution they are accompanied. So not only with the health problems, psychologically they are accompanied with various things. So they are accompanied with so many things. So that they only can say, thank you, you have brought some life to us. Your sacrifice is a smile for somebody else.